to Getting Healthy with Daisy. This is Daisy. Talking about chemotherapy nausea. So, I guess if you're watching this, if you come to it for one reason or another, you need chemotherapy or you have a loved one who needs chemotherapy. Unfortunately, nausea seems to be part and parcel with the whole process, the healing process. But the good news is it doesn't have to be. If you were to go and search through scholarly articles, you would find there's about 75 articles talking about the use of hypnosis to reduce the effects of, reduce or eliminate completely the effects of nausea with chemotherapy. And that's the case. So it's a simple process. And there's a flow-on effect here, of course, is that if you can eat, well then you'll have a lot more energy because you're able to put the nutrients into your body to provide the energy you require. But also you're at a time when you need the very best nutrition. And I know in some elements of the cancer world there isn't much credence given to the role of nutrition, but as we all know, if we don't eat, we don't feel well anyway, and if we don't eat, we run out of energy and we can't heal. Our body requires the amino acids in protein, for example, to be able to work with our immune system. But the point here is that feeling of nausea doesn't have to exist. Daisy likes to lick. She licks everything pretty much. There you go. She's a little blind dog, and she has amazing capacity. She can move around very well, and so she's learned to live with that part of her life. And like a lot of dogs, when they're feeling nauseous, they will go out the back and eat some grass. Well, for humans, it's not really appropriate or desirable, but hypnosis can help. It can relax, it can calm, and it can be used in a number of ways on changing that relationship between yourself and the chemotherapy and how you respond to it, changing your relationship between yourself and the hospital environment or the medical environment, and giving you strategies right in that moment to be able to deal with unpleasant situations. Now, I had a situation recently where, as a consequence of some simple surgery, I had a complication and I had to go back in and have some more serious surgery. And the first thing they did was stick a gastronasal drip into my stomach. Well, as I sat there on the edge of the bed, I was feeling really unwell, but I just dropped myself into some hypnosis. And the nurses came, and one nurse kept saying, relax, relax, and I felt like saying, I am relaxing, leave me alone, I am relaxing. But I was able to wash off, I'd estimate about 90% of the problem, because it's something that many people struggle with. It's a very unpleasant feeling, but you can do it. You can take yourself to another place. So there's a number of strategies we can use. Basically, if you'd like my help, my name is Ian Newton. You can come to my website, iannewton.com. I can help you from anywhere in the world on Zoom. Zoom's like a Skype but more efficient, and I can help you set that up. It's free. So I can work with you, and we can solve this nausea problem, allow you to become better nourished, have more energy, just feel better, feel it. You don't have to avoid food and you can approach your chemotherapy with less trepidation. Because nobody likes being ill, nobody likes vomiting. That's even an unpleasant word, isn't it? It's an appropriate word for what's actually happening. So come to the site, have a look. You can contact me if you'd like to work with me. I do something for chemotherapy clients that I don't do for anything else. I offer a money-back guarantee. So why do I do this? I can't guarantee that I can stop everybody from getting nausea. However, I do believe that I can help most people to either completely avoid nausea or to feel much, much better. But I do it because you've already got enough to be concerned about. You don't want to worry about, will this work, and am I going to spend money, and so forth. So I do it from that perspective, and I'm happy to do that. So from Daisy and I, we wish you the very best. she's going to go from sleeping here to sleeping on the floor, I suspect. Great, thank you.